Dr. Choll Kim here, sunny San Diego, California. All the way from New Zealand. Look at the size of these disc herniations. Look at that. He's expecting a perfect job utilizing the most minimally invasive technique possible, the uniportal interlaminar endoscopic technique, LESS, laser endoscopic spine surgery, LESS, which you have to admit is a very cool name for a minimally invasive procedure. So we'll make a little poke hole at 4-5, sneak in to the corner of the interlaminar window, go past the dural tube, move it over, pluck out the disc herniation, free up all the nerves, make sure everything is free, remove any loose disc fragments, and then same thing at L5S1. Chromatodiscogram time, shot and save. Shot and save. Shot and save. Oh, look at that leak. Immediate. Shot and save. You can see it. Oh, there's two of them. Two big tears. Shot and save. Shot and save. Ooh, it's the other disc herniation is now getting outlined. Up at 4-5. Shot and save. It's probably slowly leaking out. The opening into the canal. I just switch the cannula to the regular. There's the epidural fat. His disc herniation's huge and he's got stenosis, so I have to be very, very, very careful. And oh so gentle. But that looks pretty dang good. Oh, I need to do way more work though. I'm being so sneaky. There's the dural tube right there with all the veins on it. Isn't that creepy? It's like building a ship in a bottle. Oh, so much adhesions and epidural fibrosis. It's like taking gum out of shag carpet. I'm past the dural tube finally. I want some credit for the hard work that I did though. Yep, it's definitely calcified. There's the defect. Oh, look at this. Save these pieces. Can you hold the cannula just right where it is? I have to take the whole scope out. That piece right there. Okay. This is about to come out, but not without a fight, like my punk teenage kids, no doubt. Very tough, very calcified, very large, very annoying. Oh, I'm not going to give up. I'm relentless. I've had teenage kids. Oh, look at that. The kakapupo finally reveals itself. There it is. Can you come in for a quick AP?
Yeah, absolutely.
Yep. Oh, yes. Come to Papa. Can I have the regular tooth here real quick? Look at this monster about to pop out. Look at that thing want to pop out like a pimple. Right there. The disc herniation out from underneath, excavated everything. Also got it from the top. Laser, oh, there's still a little bit of right here. There's the dural tube, surrounded by lots of scar tissue. Thank you, Scott. There we go. There's the dural tube. It is totally mobile now. Woo-wee! You can see directly over the top. I wouldn't be surprised if it starts pulsating. Like that. Creepy, isn't it?
It's a good creepy.
A good creepy. And look at that little poke hole. Okay. Simple popping maneuver time. There it is. Ooh, it's still thick. But there it is. There's the dural tube. Can I have the angled Pac-Man next? Look at how stuck down that is. Look at that. Look at that. Oh my God, this is crazy how stuck down this is. That is such a good picture of the inflammation. Look at that.
It's angry.
It's pissed. It is stuck down. Oh, look at that. There's the disc herniation. This level's not as big. I'm just moving this nerve over, just nudging it over little by little, releasing it. This disc herniation is not as big, but I bet you this is just as big of a problem though, because this looks softer, more empty tent-like, with just as much adhesions and more inflammation. And this disc herniation is bigger than what the MRI shows. That's a good thing. That means I expect you to get better by a lot. Okay, I rotated the dural tube away from me. It's on the other side of this metal wall right here. And there's the disc with inflammatory tissue over it. There's the empty tent sign. Look how pathetic that is. Kakapoo disc right there. Can I have the regular tutor real quick? Yep.
You're gonna want that.
Okay, there was the disc herniation. I basically excavated it from underneath. And then there's the dural tube. Look at that. It looks so much healthier and happier. It's now mobile. It's not pinned down by this big disc herniation. Look how happy it is. Okay. Very happy. And everything should collapse on itself. into a tiny little hole. Look at that. Surgery's all done. It went beautifully. There was huge disc herniations that were completely socked in with scar tissue, and it was a mess in there. But we took our time and we did a perfect job with these 2 little vampire bites and these 2 very, very nice Band-Aids. So we're all expecting a great result. We're all praying for a speedy recovery, so best wishes.